Indiana Newsdesk is made possible in part by Maller-Grodner Attorneys, providing legal services to clients and the community. Understanding, expertise, results. Bloomington and Indianapolis. LawMG.com. IU Center for Rural Engagement, extending IU Bloomington resources to improve Hoosier lives in partnerships with communities and organizations. rural.indiana.edu. Smithville Fiber Internet Security Solutions and Voice in Southern Indiana. More information at smithville.com. Bunger and Robertson Attorneys at Law, utilizing 75 years of experience, knowledge, and resources to help individuals and families recover in personal injury matters. Information at lawbr.com. And by WTIU members. Thank you.
Coming up on Indiana Newsdesk.
There's a lot in this bill that's worrying, but definitely having the government so involved in our curriculum and what we're teaching worries me a lot.
A bill targeting DEI is moving through the statehouse. The bill's author says it's about fairness, but doctors say it's bad for the healthcare industry.
Commercial chicken farmers are being hit hard by the avian flu, and that hits not only their bottom line, but also can take an emotional toll.
These people love what they do, so the idea of eliminating them is setting the money aside. It can be pretty emotionally damaging to have to go through these experiences.
Nearly 7 million commercial birds have been lost to the flu since 2022. And Connecticut lawmakers are looking to ban production of the drug used in Indiana for federal and state executions. These stories and more right now on Indiana Newsdesk. Welcome to Indiana Newsdesk. I'm Joe Wren. State and federal politicians are taking aim at diversity, equity, and inclusion in public schools. Indiana Senate Bill 289 would remove some DEI training and programs in Indiana if it's passed. Higher education reporter Aubrey Wright has more on how medical schools inspired the bill.
The bill's author says Indiana's medical school applications process inspired it and his demands for equal treatment for all students. But medical experts and students say DEI levels the playing field as schools lack diversity. In between her work at the hospital and classes, Indiana University medical student Owen Menez is speaking out in support of DEI.
It's hard because we say DEI, but we need to understand what that means, and it's diversity, equity, and inclusion, right? There is no part of this that's meant to exclude anybody. It's in the name.
She's a member of the DEI Coalition, a student group, and to Menez, DEI means getting the best out of everybody. It means doctors have a better education and patients receive better care. But she says the proposed bill could jeopardize that.
There's a lot in this bill that's worrying, but definitely having the government so involved in our curriculum and what we're teaching worries me a lot.
Parts of SB 289 come from Senator Tyler Johnson's experience as a doctor and as a mentor to a student applying to med school. He didn't respond to multiple interview requests, but addressed the Senate in February.
He felt discriminated against, which obviously he was during this process, going through the medical school admissions process at a university here in Indiana.
He says the student believed he had to conform to a certain ideology, and some medical faculty supported the bill.
I've had multiple fellow faculty members here to testify in front of committee.
Doctors, students, and medical associations are pushing back on calls to remove DEI values from medical education.
DEI, by definition, levels a playing field.
Good Trouble Indiana is a grassroots advocacy group focused on healthcare.
Are medical schools diverse today? Do you think
No.
that they should be doing more?
Well, for many, many years, they haven't been diverse.
Walsh says Black, Latino, and Indigenous people are underrepresented in medicine, and that hasn't changed in years. After affirmative action and race-conscious admissions were banned in 2023, medical schools such as IU's saw dramatic drops in diversity.
Menez says critics of DEI should shift their focus to removing financial and class barriers to medical school.
We're not trying to make sure a certain group doesn't get into medical school. Medical school admissions are getting harder.
Walsh says improving patient care is the most important reason for diversifying medicine.
Care delivery is different. Seeing doctors and the healthcare team who look like us really matters, and this science bears this out.
Menez agrees that there should be a diverse doctor workforce.
We need men to be treating men who don't feel comfortable with a woman examining them. We need women to examine people who have been assaulted, and they just don't feel safe around certain types of people. We need people who speak Spanish. We need people who speak French.
Menez wants to work in pediatrics after she graduates. She says having each part of her identity shine and help patients has made the tough times worth it.
It has been good to kind of bring everything together and put it into patient care, get to where we are now. It feels good.
SB 289 passed the Senate and advanced to the House of Representatives. The U.S. Department of Education is also pressing schools to get rid of DEI programs and scholarships. For Indiana Newsdesk, I'm Aubrey Wright.
Debate over property tax reform began in the second half of the legislative session Wednesday, the same way it ended the first half. Indiana Public Broadcasting's Brandon Smith reports that's with local government leaders sounding the alarm on their budgets, while Governor Mike Braun's office pressed for taxpayer relief.
The current bill is focused on relief for older Hoosiers, disabled veterans, and first-time home buyers. Braun's proposal would have provided significant relief for homeowners across the board.
The governor's been transparent and consistent in every conversation he's had on the issue for well over a year. Government should not grow faster than the taxpayer's ability to pay for it.
Braun's plan would have cost local governments and schools billions of dollars a year. Knox County Commissioner Kelly Streeter says the current bill still puts local governments on a path that harms taxpayers.
79% of my county general goes to the judiciary and law enforcement. Let me be clear, that's 4 of every $5.
Local government leaders say the measure will force cuts to services and personnel.
With the rising cost of buses, transportation, fuel, insurance, it's just outpacing what we're getting from our local levy.
For Indiana Public Broadcasting, I'm Brandon Smith at the State House.
Governor Mike Braun signed an executive order this week to align with federal moves to ban transgender women and girls from playing sports. Braun says the executive order is meant to support a measure moving through the legislature to ban transgender women in collegiate athletics.
Whatever's crafted in legislation, whether it adds to it, takes away from it, I'm guessing the intended purpose is going to be the same.
He also signed a second order for executive branch agencies to enforce the biological binary of gender. Advocates say even if the executive orders make no real changes, political leaders dehumanizing transgender Hoosiers is dangerous.
The studies show that when this kind of rhetoric happens, violence happens. So our big thing, the thing we're screaming as much as we can is we just need everyone to tone down this rhetoric before someone gets hurt, because it's likely going to be a child.
O'Haley Burns says these political acts are largely built off of misinformation and paranoia about transgender Americans. There's so much wind and solar energy being proposed in the U.S. that there's not enough power lines to get that energy where it needs to go. Building out that new transmission is expensive. It's one of the things causing Indiana utilities to raise customers' electric bills right now. Indiana Public Broadcasting's Rebecca Thiel reports legislation that passed unanimously out of a House committee this week aims to help.
The bill requires utilities to consider advanced transmission technologies in their long-term plans. That's technology that can be added to things like power lines to make them more efficient and reduce congestion. The Hoosier Environmental Council says they can also reduce how often cheaper, cleaner sources like wind and solar get curtailed. That's when grid operators restrict an oversupply of energy flowing to the grid to prevent blackouts.
Grid-enhancing technologies really is the most effective and the fastest and the cheapest way to get more capacity out of our existing grid.
Utilities will still have to build more power lines in the next decade, but the bill could prevent some electric rate increases in the short term.
which can hopefully lead to fewer increased costs to customers, including the older Hoosiers who are already struggling to afford their utility bills on top of higher costs such as food and medicine.
For Indiana Public Broadcasting, I'm Rebecca Thiel.
Utilities, the AARP, and environmental groups support the bill. That includes Audubon Great Lakes, which says building fewer new power lines would reduce bird deaths. The bill now moves to the full House for consideration. Now for more headlines from around the area. The financial impact of property tax reform on cities and towns was the main topic of this morning's legislative panel in Ellettsville. Elected officials from Monroe County joined residents to discuss Senate Bill 1 and how lawmakers will compensate for less money for public safety and other county services. That includes a bill that gives counties the option to charge an extra $1 to enter state parks, which could help Brown County in the long run.
They're keeping their nose above water and they're paying what they need to, but Senate Bill 1 will probably have a negative impact on them if we see these reductions for the local government. So this is a way to help them kind of sustain that.
Hall estimates the entrance fee increase could generate up to $120,000 for Brown County. The Bloomington City Council has approved a transfer of the land for the Convention Center expansion project from the Capital Improvement Board to the city. The new Bloomington Convention Center will be funded by food and beverage tax revenue. Local income tax revenue can also be used if needed. Bloomington's mayor says the center is vital to economic development and downtown expansion.
It brings presence on the Beeline, and of course, it is becoming critical to Bloomington to attract the very best tourism.
The latest design budget is just over $70 million. The Capital Improvement Board will continue to oversee construction, which is set to begin in June. Organizers are working to reinvent the taste of Bloomington this year. The popular annual Summer Food Festival hasn't been held since the COVID-19 pandemic. The event was canceled after 2022 because of labor shortages, increased cost, and lack of volunteers. Now, officials say bringing the festival back is huge for downtown Bloomington.
Taste started in the early 1980s, and each decade has its own feel to it and own touch and own volunteers that are participating in new food trends, music trends.
Chocolate Mousse Operations Director Jordan Davis says he and about 20 others are working on a more sustainable and equitable model. He says the taste will be on Kirkwood Avenue on August 2nd and will not be ticketed. Coming up next on Indiana Newsdesk. Indiana could have a harder time finding the drug it uses in executions if a bill in the Connecticut legislation becomes law. And poultry farmers face not only financial hardship, but a mental one too, from lost flocks due to the avian flu. These stories and more right here on Indiana Newsdesk.
I'm a queen. I don't fear anyone.
This was a woman people wanted to follow.
You are an important part of our work.
You're stronger than you know.
Saddle my horse immediately.
She's a female trailblazer.
We did it by acknowledging our own worth. Oh, please, do continue.
Asking tough questions to those in power.
Russia right now has you outmanned, outgunned. Is it time to think about a settlement?
As a newcomer to Congress, what did you make of the high degree of dysfunction within the Republican conference?
I always felt that it was broken.
And covering events as they unfold.
Opposition fighters have reached the suburbs of the capital, Damascus.
PBS NewsHour and PBS News Weekend, every night on PBS and streaming.
Welcome back to Indiana Newsdesk. Lawmakers in Connecticut want to ban state companies from profiting off drugs used in federal executions. As George Hale reports, a bill under consideration there would make it harder to carry out lethal injection executions here in Indiana.
Senate Bill 430 would ban people and businesses in Connecticut from making, selling, or testing drugs for the purpose of carrying out executions. Connecticut abolished the state death penalty in 2012, but there's no ban on involvement in executions elsewhere. A Democratic lawmaker there says business practices should align with state law.
People feel strongly that going forward, the companies in the state of Connecticut should not be involved in any shape or form, directly, indirectly, into being part of any other state or beyond efforts to be part of death penalty.
Senator Saud Anwar's bill follows reporting last year that a Connecticut-based chemical supply company helped manufacture an anti-seizure medication used by the Trump administration to execute 13 prisoners in Terre Haute in 2020 and 2021. The drug, pentobarbital, is blamed for botched executions in several states and at the federal level. Before leaving office, former President Biden's Attorney General instructed the U.S. Department of Justice to stop using it in future executions. Now back in the White House, President Trump wants to reinstate the death penalty at the federal level and pursue more capital cases.
I've already signed an executive order requiring a mandatory death penalty for anyone who murders a police officer, and tonight I'm asking Congress to pass that policy into permanent law.
Anwar says his legislation isn't a response to Trump, it's codifying the will of the majority of the people of Connecticut to get out of the execution business.
The current administration at the federal level, they will do what they will do, but in the state of Connecticut, we do have a clear understanding of where we stand, and we will stand by our values and make sure that whatever the federal government does not necessarily make us do something that's something that we do not agree with.
But the proposed ban doesn't have the support of some key constituencies. Medical organizations are concerned about the impact it could have on the availability of medications used for other medical purposes. Veterinarians use the anti-seizure drug pentobarbital to euthanize injured and sick animals, and hospitals use it and other drugs like it during surgery on humans. Opponents of the bill include the Connecticut Hospital Association, which is asking for changes to avoid disrupting drug supplies.
It's hard to know what kind of effect this might have.
Death penalty expert Robin Marr says European Union prohibitions on the exportation to the United States of certain drugs used in lethal injections is the closest analogy to what lawmakers in Connecticut are attempting to do.
There is a precedent for this as a policy matter. I don't think that I've seen another state attempt to do what Connecticut is proposing to do.
As a result of those prohibitions and increased scrutiny of lethal injection as an execution method, states with the death penalty work hard to protect suppliers.
All of the active death penalty states now have secrecy provisions in place that prevent us from knowing where they obtain their drugs. So I don't know how many other states might be looking to Connecticut for their drug supply.
In Indiana, corrections officials used the same drug, pentobarbital, to execute a state prisoner last year. It was the first state execution in more than 15 years. Where the state obtained its supply of pentobarbital is a mystery, thanks to a 2017 state law exempting information that could reveal the supplier from open records. For its part, the Connecticut company accused of supplying pentobarbital for use in federal executions says it has stopped making the drug. Connecticut's legislative session ends in June. For Indiana Newsdesk, I'm George Hale.
There are currently 3 inmates on federal death row and 7 on Indiana's death row. No executions for either are currently scheduled. As commercial flocks in Indiana continue to be devastated with bird flu, industry workers wrestle with financial troubles and mental health. Clayton Baumgarth reports on the resources available to those farmers who collectively have had to put down millions of birds.
Since 2022, Indiana has lost nearly 7 million commercial and hobby chickens, egg-laying hens, ducks, and turkeys. The spread of highly pathogenic avian influenza shows no signs of slowing down, as outbreaks have been reported nearly every week since the start of the year. Roseacre Farms in Jackson County, which lost over 2.5 million egg layers in late January, recently testified to the Senate Agriculture Committee about the situation.
Since 2015, we have lost 10 million birds to avian influenza, 6 million of those since January 1 of this year. That's 25% of our current production.
During his testimony, Wesner emphasized the need to develop and deploy a vaccine as soon as possible.
I'm not sure vaccine is 100% the answer, but I think that if we go down that road and we start there, there'll be people work hard and spend a lot of money to try to come up with answers.
He also spoke on how the industry needs continued financial assistance to weather the storm.
There's been $1.4 billion worth of indemnity paid out since '22. I would ask that we continue to look at that with common sense and fairness. It's a way to have a stopgap measure to keep people in business.
Indemnity payments aren't the only tool keeping farms afloat as they rebuild their flocks. There are insurance programs available through the Farm Service Agency.
Insurance payments work like what you would expect insurance. Now, it doesn't follow underneath like the standard crop insurance, but there are livestock insurance programs and indemnity programs implemented by FSA.
Malone says that even with these programs in place, money is tight. Rebuilding a flock can take up to 6 months after an outbreak. That's 6 months of financial uncertainty and personal stress for flock owners.
This could be extremely dire. I think that there are always cases where we experience some type of negative shock, and the biological lags that are required to rebuild a flock and start producing eggs again can be pretty disastrous.
And that 6-month rebuilding process assumes that no other infections occur. If one does, the process starts all over again. Not only are farmers worried about their balance sheet, but there's also an emotional stress happening simultaneously.
These people love what they do. They work really hard to give those hens a good life. Those layers are something that's quite valuable to them. So the idea of eliminating them is setting the money aside. It can be pretty emotionally damaging to have to go through these experiences.
That's where Purdue's Farm Stress Team comes in. It focuses on helping ag industry workers better manage their mental health.
I went to FFA convention this year to talk with youth about the importance of taking care of your mental health and the unique stressors that come with agriculture and the lives that they are living.
A large part of their work includes teaching people how to handle working in an industry where so much is out of their control, such as whether it rains.
There's so many aspects in agriculture that are ultimately out of our control. So like if there is a disease going around, what prevention can you do to ultimately help your livestock or your operation?
The team is made up of those with health and human science backgrounds, as well as those with extensive knowledge of the business of agriculture. For Robinson, who operates on the border of Ohio, where many bird flu outbreaks have been reported, work has been busy.
There's just so many mixed emotions that they could be going through. So some of the tools that we recommend is definitely how to cope with grief during this time, because it is similar to like a family farm if they lose the operation.
The biggest thing the team emphasizes, though, is that farmers are more than just their farming operation. It's an important reminder for an industry that often says farming is a way of life. For Indiana Newsdesk, I'm Clayton Baumgarth.
And some students on Indiana University's campus have developed their passions for baking into a business. As Isabella Vesperini reports, baking serves as a creative outlet for them.
Christian Oates has always loved cooking. He has been baking cupcakes since high school and officially started Cardinal Cupcakes a few years ago.
Like my first real memory in the kitchen was making breakfast, like breakfast pizza. Then throughout high school a little bit, I did some like Rice Krispies and everything. I don't know how I ended up doing cupcakes, not gonna lie. I think it was just easier than a cake and easily shareable.
Oates started with cookies and cream cupcakes and has experimented with other recipes, baking s'mores, red velvet, and vanilla cupcakes. He finds recipes scrolling through Pinterest and tweaks them to make them his own.
Before this, I kind of hated cupcakes, so I like to make them in a way that I would eat them, so they're less sweet and they're light. I know people hate the icing of a lot of different cakes and everything because they're too sweet, too thick, and the cream cheese or whipped cream icings, they're lighter in texture and lighter in sweetness, but they're still really good.
As a college student, Oates says time management can be challenging. On a perfect day, he'll start early in the morning, but he often finds himself baking late at night.
The latest I've probably been baking was I've stopped at like 3 a.m. and that was me kind of forcing myself to stop before I go crazy.
Jake Lazar grew up eating his mom's Mandel bread, a mix between biscotti and chocolate chip cookies. He launched Grandma's Goodies 9 months ago to keep the family recipe alive. It was created by his great-grandma.
She went to, culinary school, and I've just always grown up around her baking and cooking. In addition to my dad, he's also a big chef and baker. So I think just being a little kid and being around it all the time, it's kind of hard not to want to know more about it or just even get good at it yourself.
Lazar bakes in bulk depending on demand. As a part-time student, he has more time to bake and focus on marketing through social media. He bakes out of a commercial kitchen in town, taking up to 12 hours to complete one batch.
I live with 8 other guys, and I quickly realized that wasn't going to be feasible, because they're always coming over to like, hey, like, what are you making? Can I try a bite of that? So quickly I was like, I think I need to find something new.
The main mission of the business is to give back. For every 12 bags of cookies sold, Lazar donates 1 pound to local food banks. He currently partners with Beacon to distribute cookies.
It's not a common occurrence where someone who's less fortunate has the opportunity to get a freshly baked dessert.
For Indiana Newsdesk, I'm Isabella Vesperini.
That's the end of this program. Don't forget to set your clocks forward 1 hour Sunday morning. Have a great weekend.
Indiana Newsdesk is made possible in part by Mallard Grodner Attorneys, providing legal services to clients and the community. Understanding, expertise, results. Bloomington and Indianapolis. LawMG.com. IU Center for Rural Engagement, extending IU Bloomington resources to improve Hoosier lives in partnerships with communities and organizations. Rural.indiana.edu. Smithville Fiber Internet Security Solutions and Voice in Southern Indiana. More information at smithville.com. Bunger and Robertson Attorneys at Law, utilizing 75 years of experience, knowledge, and resources to help individuals and families recover in personal injury matters. Information at lawbr.com. And by WTIU members. Thank you.